10 reps of an exercise twice a day just isn't enough because
movement.
Nope.
No.
You know, you stretch it bent at 9 in the morning, and then you stretch it bent at 3 in the afternoon.
It's too late.
And look how, how it's tightened.
Yeah, you feel the difference. I mean, that one is definitely like an understated tip in terms of when did you know that it was essentially time to have surgery? Because I get asked that a lot, where people, they have chronic knee pain, whether that be months or years, even decades, and they just deal with it.
If you've been wanting to learn more about total knee replacement surgery, then this video will be especially helpful for you, as you'll get to hear from one of my actual patients who recently had surgery just over 3 weeks ago at the time of this conversation. You'll get to hear her experience about her recovery so far, the unexpected challenges that she faced, how she manages pain, and some helpful tips that she would recommend to anyone who's potentially going to have this procedure in the future. Now, let's get into the interview.
Okay, perfect. Well, so I mean, before we even get started, I just wanted to say thank you for even taking the time to answer some of these questions.
My pleasure. I think it's important. I think it's important to share what I know about knee replacements with people who are going to be having one.
Definitely. I mean, you've seen a little bit of some of the videos that I made where I get to give the physical therapy perspective in terms of what the patient should expect for themselves, whether that's pre-surgery or after surgery, in terms of what they need to work on, pain-wise, how to manage everything that comes with the recovery. But from you, obviously you have a unique perspective where it's not just as a patient, but also you are a former PT as well.
And I've also had the other knee done.
Exactly. So you also have that prior experience, which also gives you more insight. So before we get into the specific questions, can you just tell me after 3 weeks post-surgery, how are you feeling overall?
I feel good overall. I don't have a whole lot of energy. And
is that fatigue-wise, or?
I do fatigue fairly quickly, more than normal. I've been taking a lot of naps because the knee doesn't let you sleep uninterrupted all night.
That's very true.
But at my age, neither does the bladder. So so I've been taking several naps during the day, but less and less every day. And I think another thing that surprised me was I haven't had much appetite since the surgery, and I don't really know why. But I guess it's a good thing because maybe I'll lose a few pounds.
That's true.
But,
that'll happen.
but other than that, I really feel good. I feel I don't feel there's much I can't do.
That's pretty good, especially being 3 weeks out.
Right.
Would you say, prior to going into the surgery, that you were kind of expecting to feel the way that you feel right now at 3 weeks? Or is this was it a surprise to you at all to feel like this at 3 weeks out?
I don't remember this from my first knee replacement, but that was 13 years ago. And that's a long time. And I was also 13 years younger.
Yes, healing's better.
So I think that is part of it. At 3 weeks, I feel pretty darn good. Yeah. So I'm not disappointed in anything at this point. As a matter of fact, I'm very pleased.
Yeah. Okay. Perfect.
Yeah.
So kind of ignoring the previous the other knee replacement, the other knee surgery, was there anything that surprised you post surgery for this more recent replacements? If there were 3 things that you just did not expect to experience, whether they be good or bad, did anything surprise you?
Well, I had some problem with pain management in the beginning. Still in the hospital, and I wasn't pleased with the opioid they chose for me. They don't like the opioid I had the last time, which I was able to work with very well.
You responded better to that opioid.
Well, I did, and I was used to it. It had been around for a long time, but apparently it's fallen on ill repute.
Yeah.
Although I do know people who take it on occasion. Anyway, so the oxycodone, and then they gave me an antispasm pill, Robaxin, together literally put me to sleep.
Yes.
When
Very
I was
symptom.
Standing, I fell asleep 7 times.
Yeah.
My husband was with me, and that's how I know it was 7 times. Because I'd be taking a step, and all of a sudden I'd go, "Oh, I just fell asleep," and he goes, "I know."
And timeline, this was at discharge?
This was at
the day
discharge,
of,
and after I got home, I felt like there was an urgency to get me out of my room. And so into that car and on home. And so I quickly stopped taking the oxycodone and tried the tramadol, and I just thought, no, never mind. I'm just going to take the Tylenol, and I'm on the 81 milligrams of aspirin twice a day, so that helps. And then you get to resume your non-steroidal anti-inflammatory, and that, especially now, helps. Well, because it's now in my system. You know, it's built up. So I have good pain control now because of those things, and using the ice and elevating
makes difference.
And I also find that if I get up and move around a lot, I have less pain.
Yeah.
If I just get up and walk around and then come back and sit, I have less pain. So, and if I move the knee more, I have less pain.
Yeah. So speaking on it, that's actually one of the common things, like I'll get asked, whether that be like from current patients or even like people commenting on some of these videos. They'll say, how often do I need to move, whether that, you know, be changing position or just the leg itself, and what does that look like? So for you, like from your experience these past 3 weeks, like throughout the day, what did that volume wise, distance wise, time wise, how often were you moving?
All right, I will say to you that if that coffee table were closer, in the period of time that we've been sitting here, I would probably have had my heel up on that coffee table twice for maybe a minute or two, and then I would have taken it off and I would have pulled it back, and I would have pulled it back as far as I could comfortably. Now this doesn't allow me to pull it underneath it, but if I were in a chair that allowed me to pull it underneath it, I would. I wouldn't keep it there very long, just enough to feel the stretch, and then I'd slide it to where it was comfortable. A few minutes later, up on the coffee table, just get it straight. It might be there for a minute, 2 minutes maybe at the most. Back down, bend it. It's never immobile for very long, and I found that has really, really helped, both with the range and the pain.
Definitely. So that's literally one of the things that can be a challenge for people going through the knee replacement in terms of how often, how long do I do this? Because then oftentimes they'll look at protocols where they'll say, do this move, this heel slide, this specific movement X amount of times, but really there's not a set number that's going to provide you with the best decrease in symptoms, It's really, you have to, and you kind of said this a little bit too, where it's like where you can tolerate it, where you're not over bending, over moving, but just enough that you're not leaving it there for a lengthy period of time.
You know, what I think I try to do is put it in its maximum range, but maximum comfortable range.
Comfortable.
Because I'm not exercising.
You're just moving.
I think a stretch is okay. Pain is not okay. Pain is for exercise, but just when I'm resting and positioning, I just pull it as far as I can to feel the stretch, but not necessarily the pain.
So no, that's a really great tip, because some people, when they hear, okay, I got to move it, I got to feel some kind of pain, but if we're talking about just at rest, changing position to make sure that you don't develop more stiffness, more swelling around that joint, I mean, it has to be somewhat comfortable, like somewhat tolerable, because then if you're pushing it past to where now you're feeling pain where it's similar to like exercise pain or even like walking, standing, like that you'll have in the early stages, now you might be overdoing it, and then you kind of almost, that balance is gone. You did more harm than good. So that's a great tip where it's like, where it's comfortable. Next question. So far, I know you had the experience with the opposite knee having been replaced, but with this time around, what has been like the hardest challenge or part for you in terms of the whole recovery, whether that be pain, mobility? It's a tough one.
Boy, it is, because I sort of knew what to expect, but I think maybe the thing that surprises me the most is the fact that it feels very, very tight when I go to move it, even though I've moved it to that position many times.
Even in the same day?
Oh, yes, 5 minutes later, and it feels really, really tight. And it feels like it's tight because the skin is tight.
Different tissues are tight.
Exactly. And because maybe because it's swollen, but in reality it's not nearly as swollen as it was
before. That's definitely one of the very common ones. Okay, next question. So this is I mean, you can apply this to even the opposite knee, but especially the more recent one. But when did you know that it was essentially time to have surgery? Because I get asked that a lot, where people, they have chronic knee pain, whether that be months or years, even decades, and they just deal with it, and they're like, is knee replacement even, is that good for me? Is it too early? Is it too late? Like, when did you know it was the best option?
Well, I knew, actually, with each of my knees, when it was ready, it was because the knee would, when I was weight bearing on it, would clunk. So when I was doing, like, trying to do balance exercises, standing on one leg, I couldn't stand on this right leg because it would clunk over.
Yes.
And it was painful when it did that. And, you know, I was surprised people couldn't hear it, because I say clunk over, and
You can
that's
hear
what
it and
it
you
felt
feel
like.
it. Yes.
Yeah, you know, I'm sure it was a clunk feel rather than a clunk sound. But nevertheless, yeah, so that's when I said, okay. And it was making it much harder to walk, much harder to walk.
So, I mean, pretty much it's affecting you throughout the day, every single day.
Oh, yeah.
Anytime you're standing, right?
No, yeah.
Yeah, it's that instability.
Yeah, I just, and it was, you know, the pain on instability. And you always wondered when it would give, you know, like, because you think of the knee buckling, but it wasn't buckling like I would fall.
Yeah.
Yeah, it was buckling medially, inside, So, but sometimes I worried that I might fall, you know, I didn't like that.
And then kind of following that, pain-wise, like, how severe did that get, 0 out of 10? You know, that's subjective, but, like, at its worst?
Oh, I'd say maybe a 4 or 5, you know, when it, or even a 6 when it clunked.
Okay,
you know?
yeah.
But I mean, I could be pain-free sometimes, but, you know.
But how often it, like, was unstable when you're day-to-day?
Whenever I stood on it.
Yeah,
by itself, you know, or often when walking. So I didn't use a cane or anything before, but maybe had I, that might have helped. I don't know.
Yeah, but still, you don't want to be restricted to an assistive device if you don't have to.
Right, exactly, exactly.
Yeah, and I mean, I feel like in terms of indications for a total knee replacement or total joint replacement, that's one of the instability is one of the things that some people overlook. They just think that I have to have 9 out of 10 pain in order for me to be indicated or you know, thought of as an option to have that joint replacement. But that significant instability where it's happening not only daily, but pretty much any time that you're weight bearing, especially on one leg, it's like that's one of the big, you know, indicators that you're a candidate for your joint replacement. So.
You know, now with my other knee, though, I would wake up in the middle of the night in severe pain. I mean, crying. And I didn't have that this time, but I think I had more instability this time. Or maybe because I'd had the first knee done, I wasn't quite as afraid to delay it.
Yeah.
You know, I mean,
You experienced the left knee successfully and recovered, and you're like, okay, I can do it with the other one.
Exactly. Exactly.
Okay. Next question. And then this is going to be more interesting coming from your perspective as a previous PT. But how has physical therapy helped you? And if it did, would you recommend it to people who are going through a joint replacement?
You couldn't do it without. First of all, you need the instruction. Even though I know what you're talking about, I need you to instruct me so that I do it correctly. And also I need you to evaluate my progress, and I need the encouragement I get from you. I feel much better doing the exercises when you're here than I do when I do them on my own. Yeah, because the encouragement is really a big part of it, and plus the assessment. You know, nice to know that, wow, that many more degrees. You know?
You're making some actual objective changes, especially like session to session, and within that first 2 to 3 weeks after surgery, it's like every day counts. You know, so when we're seeing you 2 to 3 times a day or 2 or 3 times a week,
it's important.
It's like you need to be hitting certain milestones to an extent to make sure you're on the right track, right?
You know, and again, I'm going to go back to my time as a physical therapist, and it was a long time ago. And I remember when I first started seeing knee replacement patients, I called the orthopedist who was referring them to me and asked him exactly what I should do, because I'd never seen a knee replacement before. And he said, well, you know, I think you should do what you feel comfortable doing. We want to increase range of motion and strength. And so that's what I worked on. But nevertheless, the knees were not being done as well then. So there was not the mobility. I had several patients, and I didn't have very many. I saw other therapist patients afterwards who had to be manipulated under anesthesia.
Yes.
And the
Very
pain
tough.
they had was awful. And I swore that after my first one that had to have an MAU, I said,
yeah.
And I would explain to them why we had to work so hard to get that mobility back.
Early.
But I think that the knees they're doing now are better. The surgery is more efficient. And I know, like, there was no chance with my first knee that I would have to be manipulated under anesthesia. My second knee is recovering much faster than my first knee.
Yeah.
And I think it's because the techniques have improved.
Everything is advanced.
Everything, yep. It's, it makes it, it's just a much more positive
Yes.
experience, than it was.
I think so too.
Yeah.
And I mean, that's because then, I've seen like comments from in other videos where for some, whatever it be location wise or insurance issues or anything like that, where some individuals who get the knee replacement, they don't even receive home health physical therapy. And I'm like, outcome, like obviously like for us, like, it's going to be much tougher in terms of recovery.
yeah.
So that's why I try to put out as much helpful information that they can use.
And I think what was important was that you were here the day after I got
Yes,
home.
it's
That
very
was,
soon,
I
very
thought
soon.
that was really good.
Early intervention.
And yes, I thought that was excellent, and because there was no time. I mean, I still hadn't worked out the pain pills and all that sort of thing, but you already had me doing things and making sure I was safe doing them. And so, no, I thought that was a really important part of it.
Yeah, and I mean that's super important because then that's another common question I get is where as a patient or potential patient they'll say, when do I need to start physical therapy? Well, ideally, if we can see you the very next day that you get discharged from the hospital, there's a lot that we need to get you started on, even though they're going to be lower level, not super high intensity, but also just the education of the precautions, like what you're allowed to do, what you're definitely not allowed to do that can make things worse. So the earlier.
What if I hadn't never had a knee replacement before and I was most comfortable sleeping with a pillow under my knee?
And
I didn't see you for 3 days after surgery.
Exactly. And then one of the tough part about that, because then I'll hear that too, where it feels better if I put a pillow underneath my knee while I sleep, or otherwise I can't sleep with my knee straight because it's too painful. But like, as you know, and as I try to teach all my patients, is we're going to lose that extension, that full straightening of your knee. You're going to lose that if you sleep with that pillow underneath the knee. So the earlier we can see you to make sure that you're doing the correct things and avoiding the wrong things, it's like your outcomes going to be so much better.
Exactly. Yep.
Very last question. And
yes.
I mean, so far, everything that we talked about and you've kind of given us is, super helpful. But if you were to say, here are 3 tips, 3 things that I would recommend for any person or patient who's going to have this surgery, what would what advice would you give them?
Well, I would warn them that 2 weeks before surgery, you have to stop taking your anti-inflammatory. You have to stop taking your turmeric, your glucosamine, your aspirin, anything you took that helped make your knee less painful. Generally, by the time you need a knee replacement, you also have arthritis other places. Many places you don't even know you have it until you're no longer taking that medication. So that last week, you've got a week where it's still in your system, and then you have a week where it's not, and you have pain everywhere. Strange places, thumbs, sternum, you name it.
You didn't know about these places.
Oh no, and that's something to know about and just be prepared. There was no way I was going to take even Tylenol then, because I didn't want my body to become accustomed to it so that it maybe wouldn't work after surgery.
Yes.
So I just gutted it out, but know that you do have to gut it out. And don't leave your last minute, like house cleaning things and shopping for that last week, because you can't do it.
No, gotta get taken care of as soon as possible.
Okay, and so the other 2 things I would recommend, and again, we've already talked about them, sleep with your legs straight. And they do tell you that in the hospital.
Yes.
Now the first knee replacement, I actually woke up with a small towel roll under my ankle, but this time I did not. And it was okay. It was comfortable with that towel roll. It was like a hand towel.
Yeah, small.
So, and it was folded in such a way that I couldn't roll my leg out or in, which was good.
That's good, yeah.
Because it kept it in extension.
Yep.
And the other thing I really think is so important is just changing position often
Yes.
afterwards. Just that's just, I think, the key.
Yeah.
To, 10 reps of an exercise twice a day just isn't enough, because
Movement,
nope.
No.
You know, you stretch it bent at 9 in the morning, and then you stretch it bent at 3 in the afternoon.
too
and
late.
look how, how it's tightened.
Yeah, you
Yep.
feel the difference. I mean,
So-
that one is definitely like a understated tip in terms of, yeah, you want to be frequently moving it. I mean, even as
Exactly.
we're kind of having this conversation and you're answering all these questions, like you're consistently
Exactly,
moving it. So
I am. That's my life right now.
it won't be for too long, but you're doing great. Well,
Exactly.
those are all the questions I had. Thank you so much
Thank
for
you.
answering
Thank
and giving me
you.
all your time, because I
Thank
mean,
you
it's
for-
very helpful for, you know, people to get that perspective from not only a patient but also a former PT. It's
Right.
very insightful
Right.
and very helpful.
Good.
So
well, good.
thank you.
You're welcome. Thank you.
All
Thank
righty.
you for the opportunity.
Of course. Thank you.